Washington State University, Gina Wolf, an operator of Wolf Chiropractic, and Nicole Son, founder of Journey Discovery Center. We're here to talk about making sure we fight for more affordable health care in the state of Washington, specifically more affordable health insurance. And I'm going to start by allowing Dr. Mendel to talk about why this is so important and the economic impacts in our state. Doctor?
Thank you, Senator. Good morning, everyone. My name is Vidisha Mandal. I'm a professor and health economist in the School of Economic Sciences at Washington State University. Today, I'll be talking about the expiration of the enhanced premium tax credits and some important short and long-term impacts that we can expect. So let's start with what these credits are. Premium tax credits are subsidies funded by the federal government that help reduce monthly health insurance premiums for individuals and families with low to moderate incomes. These subsidies go directly to the insurer. Before 2021, eligible individuals paid between 2 to 10% of their income toward premiums. But in 2021, these credits were enhanced. That enhancement reduced the share of income required down to 0 to 8.5%, and also expanded eligibility by removing the upper income cap. So before 2021, individuals with income over $51,000 or a family of 4 with income over $105,000 would not qualify. But that income cap was eliminated. So more people were covered, and those already eligible paid less. Enhancing the credits had substantial impact. The number of uninsured people dropped by 4 million nationally. And for the lowest income groups, net premiums fell by as much as 50 to 100%. In Washington State, we have seen these changes reflected in enrollment numbers, with a 39% increase in enrollment or insured individuals since 2021. The enhanced premium tax credits are scheduled to end on January 1st, 2026. At that point, we will revert to the pre-2021 system, so higher contributions from enrollees and a maximum income cap for eligibility. That means, for instance, individuals earning more than $63,000 or families of 4 making over $129,000 in 2025 would no longer qualify for any subsidy. The expiration will have several immediate consequences. Premiums will increase for many, especially those who lose eligibility altogether. So, for example, a 50-year-old individual who receives credits in 2025 but loses them completely in 2026 could see their premiums rise by 34% in Washington, although the range is anywhere between 16 to 75%. The federal government would save an estimated $21 billion in the following fiscal year, but this cost saving will come with a trade-off, which is an expected rise in the uninsured rate. So the individual market could also see premium hikes for everyone, not just for those losing credits, due to a shrinking risk pool. Healthier individuals may disproportionately drop out of the market as premiums get higher, which weakens the pool and drives up premiums overall in the individual market. Over time, we may see even broader impacts. There could be an increase in uncompensated care, which burdens providers. People might have to make hard trade-offs between insurance and essentials like groceries, housing, utilities, childcare. There's also the risk of worsening health outcomes if people skip care or prescriptions. While some individuals might switch to employer-sponsored health insurance if that's available to them, overall provider revenue is projected to decline with fewer patients and lower reimbursements, potentially reducing access to care across the board. It will be also difficult to switch to Medicaid for the lowest income individuals and families. Currently, Medicaid covers 1.9 million individuals in Washington state. The income limit is $1,800 per month for an individual or $3,700 per month for a family of 4. But right now, several policies are under consideration, such as imposing work requirements, almost 138,000 individuals in Washington will lose coverage, Medicaid coverage, due to this particular requirement. Reduction in federal match rate, there will be $460 million fewer dollars in annual spending in Washington state because of that. And individuals will be required to pay up to $35 as cost sharing for many services. So it appears right now that combining all these policies, there will be an increase in uninsured rates.
Thank you. Thank you, Doctor. We'll now hear from Nicole Son. Thank you, Nicole, for being here. And thank you for your work at Discovery.
Thank you. Good morning. My name is Nicole Son, owner of a local business here in Spokane, an early care and education center. I'm here today to share the perspective of child care providers across the state who work every day to support families, teachers, and children in all of our communities. Small businesses like mine are the heart of our economy. We create jobs, build relationships in our neighborhood, and meet essential needs. That is especially true for child care. We care for our children's early development, but we also allow families to go to work and live in our communities. Looking ahead at the rise in insurance premiums, I have to share concerns when things go up so sharply. I'm left with impossible decisions on whether I continue to invest in my employees' health care at the rate I'm able to, or increase wages, especially when my teachers are already paid less than they deserve for the essential work they provide our community. As a child care provider, I am able to support my teachers with livable wages and childcare and healthcare benefits right now. I also am able to offer 401k benefits. If I'm not able to do that, I don't know that I will be able to attract and retain the high quality early learning teachers I have today in an industry where turnover is astronomical and we can build as many child care programs as we want, but if we can't find high quality teachers to staff them, we're no further ahead. The other balance is maintaining affordable tuition for families, which we already know is too high. And the further my costs go up, the further my tuition goes up. Most communities in Washington state are in a childcare desert. There are more children than we have slots for. And so as we're looking at this balancing act of costs, we have to realize that when families can't go to work, it's not just me that's impacted. It's every employer in every county in our state. It's manufacturing, it's retail, it's everywhere. Everyone's struggling to find workforce. So we need to make sure that we manage childcare costs and childcare tuition costs for those families. We want to keep our workforce stable and our local economies growing. We have to support small businesses to make that possible. Rising premiums without any relief strategies risk pushing more childcare businesses out of business. So we need to find solutions, partnerships, and funding strategies to reflect that reality, because when childcare works, the rest of the economy does too. Thank you.
Thank you so much. Thank you for that.
Yeah.
Thank you for your work. And Gina?
Thank you. First of all, thank you, Senator Cantwell, for inviting me to this event today to discuss the shared goal of obtaining and maintaining quality and affordable health insurance for all of our Washingtonians. It's difficult to go after Dr. Mandel and after Nicole because they've expressed the broad-reaching concerns that we have. My name is Dr. Gina Wolf. I was appointed by Governor Ferguson to serve on the Washington Health Exchange Board recently. I also come to you as a practicing doctor of chiropractic, and I'm also an owner of a small business that delivers a small independent business that delivers non-farm pain care to a number of the people in our Spokane community. So I wear many hats relating to this issue as a small employer, as a healthcare provider, and also sitting on the exchange board. We're fortunate enough that our state exchange serves over 2 million Washingtonians. We're the front door access for enrollment in our Medicaid program and also for purchasing marketplace coverage. Currently, 3 out of 4 marketplace customers benefit from the enhanced premium tax credits. That's more than 200,000 Washingtonians who get this extra help, and it's really important to them, as we've heard. The people in our state that benefit the most from the enhanced premium tax credits are older and rural residents, people who work for small businesses such as mine, freelance workers, and thousands of middle-class families. As a small business owner, the crunch that Nicole was able to express for small business owners able to provide employer-sponsored health plans are particularly challenging. we don't often think that an employer-sponsored health plan can actually be a hindrance to our employees. Because we're able to offer the group plan that we can afford, oftentimes that discludes our younger employees from staying on their parents' plans. It also keeps our married employees from being able to stay on their spouse's plan that may have richer benefits. And the third effect of that is that they're not able to go on to Health Plan Finder and find that specific plan that's just right for them and what would be affordable for them. It's really critical that we move quickly on this process. It's my experience that even when people use the exchange, they don't understand the process. And in particular, they don't understand what the tax credit actually means to them, particularly because the tax credit is placed into the exchange algorithm automatically for them. So even though this has been heavily covered in the news, I believe that the average consumer and those currently using the Health Plan Finder aren't fully educated. So I really appreciate you taking the time today to have us all have a voice in this very important issue.
Thank you so much. Thank you for your work.
Thank you.
Well, we're here today, and as you've heard from these three presenters, to talk about the affordability of health care in the state of Washington and what we can do to continue to fight for policies that are going to make health care affordable. Unfortunately, we've seen a series of policies recently that have literally made health insurance coverage harder for many Washingtonians. And as these deadlines approach, the cost of insurance is definitely going to go up, and we need to fight back. We're here today to sound the alarm about these looming threats to health care and the fact that Washington residents, especially Eastern Washington residents, are going to be hit hard. The health insurance premiums skyrocketing thanks to the cuts under the big, beautiful bill that the President signed last month. This is a real threat to the affordability of health insurance from small businesses and workers who purchase health insurance on the exchange. And also, we've had two other phenomenons, the tariffs that are increasing the cost of health care, both in the supplies and in pharmaceuticals. And obviously, what we're talking about now, the not addressing the fact that the enhanced tax credits are disappearing. They had every opportunity, and we fought and wanted to have amendments to correct this, and we were not successful. The Affordable Care Act that Congress passed in 2010 provided tax credits to individuals and small businesses because we knew we needed a marketplace that lowered the costs. Then in 2021 and 2022, in the American Rescue Plan and the Inflation Reduction Act, that amount of tax credits allowed families to save more, and that increase in affordability led to a record enrollment. Now, why this is so important is because all of these policies that add to the cost mean we're going to go back to more uncompensated care. And without insurance and without uncompensated care, then the price affects everybody and the cost of insurance goes up. Since the expansion of the premium tax credit in the marketplace exchange, enrollment doubled, and we heard about that. And the participation jumped from 11 million people to 24 million people. So the uninsured rate in the United States dropped to its all-time low of 7.9%. So as of this year, nearly 300,000 Washingtonians received insurance coverage on the exchange, about 20,000 right here in the very far eastern part of Washington. And these are the people that will be impacted. 56,000 self-employed or small business owners in Washington purchased on the exchange, like we were hearing here this morning. But all of these advances, the increases in coverage and rates, are now at risk. The expanded premium tax credits set to expire are going to raise everyone's cost. Compounding the problem they pushed through in the budget reconciliation last month will also take effect, and about 15 million Americans, including those 300 from Washington who are on Medicaid and the market change plans, also are going to be impacted. These actions have destabilized the health insurance market, and that is why we're seeing these increases go up. And it will also cost the care for everyone, even if you think that you're okay. your insurance rates. When you think about the Medicaid dollar, 1 in 5 of Medicaid and Medicare dollars are $1 in 5 spent on healthcare are Medicaid and Medicare dollars. It has an effect on the whole system. The Washington Office of Insurance Commissioners announced that companies are requesting this 21% increase, and that impending failure to address these tax credits or adequately fund Medicaid or get rid of the tariffs on health care are all adding to a huge cost to Washingtonians. So it's important to note that we can't continue to whipsaw consumers on these issues. A new Kaiser Family Foundation analysis says that insurers who are citing tariffs as a reason for increasing healthcare costs are raising their premiums 3% above what they would have requested. So we're seeing that all of these effects are taking place in the marketplace. It's estimated, and I think that Dr. Bindi covered this a little bit, that you, Dr. Bindi Mendel, that the estimates are that 80,000 Washingtonians will forego the marketplace exchange next year simply because they won't be able to afford it. So when you digest all of that, the analysis of what these increased costs mean, and the fact that people will not go get coverage, it means that the whole system will end up seeing higher costs. And that's not what we want. Coverage equals getting people lower costs, also lowers uncompensated care costs, and basically gives us better coverage. The impacts of these are that we could see Washingtonians who remain on the exchange as much as a 65% increase in premiums, and even higher here for Eastern Washington. So we need to remember we made substantial progress in covering Washingtonians on the Affordable Care Act. Now is not the time to try to roll it back. Now is not the time to basically cut Medicaid and have impacts on the system. Now is the time to make sure that we're continuing to get coverage, lower costs, and help Washingtonians on affordability when a time when affordability is such a critical issue across many fronts: food, household goods, and a variety of other things. Certainly, let's not make health care more expensive. Thank you. We're happy to answer any questions.
Hi everyone. We're going to move into the Q&A portion of this. If you have any questions on the topic at hand, feel free to chime in and I'll go ahead and call on you. Any off-topic questions we can save for polls after the fact.